Hi, my name's Aaron McCool. I'm presenting with Frida Snyder and Kaprina Stone, and we're going to be talking about diabetic retinopathy. And Frida's going to start us with an overview of that.
All right, so an overview of diabetic retinopathy. It's caused by juvenile or type 1 diabetes or type 2 diabetes. Changes in the blood vessels of the retina cause hemorrhaging or bleeding in the retina and vitreous, and it may lead to retinal detachment and blindness. All right, so I did use some jargon there. Let me break it down. We have the retina, which is the nerve layer lining the back of the eye. It takes in light information, changes it to an electrical signal or message that goes to the brain. We have the vitreous or vitreous humor, which is the gel-like substance that fills the eye. And then we have blood vessels that carry blood to the retina. I do want to point out on this slide, I do have a diagram of the eye, and I underlined retina and drew a squiggly line to draw emphasis to where the retina is on that diagram. So what is diabetes? The pancreas stops producing insulin, or it's not producing enough insulin, leading to a buildup of unused sugar, which then damages that retina. Injections of insulin are necessary, and individuals need to monitor that blood sugar. So the blood sugar level can damage your retina, which causes leaking or bleeding in that area. And how does diabetic retinopathy affect vision? So we're going to find out. There are four main stages. We have mild, which has the presence of microaneurysms or swelling of blood vessels in the retina, sometimes a little bleeding. You may not have symptoms here. Moderate, we have swollen blood vessels that begin to block nutrients to the retina. Vessels become damaged and leak fluid into the eye. And we have blurriness or floaters here. Stage 3 severe, we have that continued swelling, significant decrease of blood flow to the retina, and then we're seeing more damage, the dark spots, you may have some vision loss here. And then stage 4 proliferative, our body's growing new blood vessels, but they're very weak, they're prone to bleeding, we have some more vision impacts, higher likelihood of scarring, which then can lead to retinal detachment and a full loss of vision. And you can see some of the diagrams that we have to show some of that here. All right, so Aaron's going to tell us about vision.
So, like Frida said, this is a progressive disease. And what's going to happen is at the beginning, there's very little symptoms, if any, and then you start getting increased sensitivity to light, floating obstructions, blurred vision. As you move through the stages, those are going to get more acute, and you'll start losing color. You can lose color vision, have double vision, reduced visual fields, and then ultimately it can lead to total blindness. Now, because it is progressive, looking at it as far as being with a student means that you're going to need to consider accommodations and consider introduction to ECC periodically. You should be revisiting that periodically with the team in combination with doing a learning media assessment and a functional vision assessment. If your student is starting to have any of these symptoms, it'll be time to start thinking about accommodations. This is going to vary depending on what symptoms they're having and how much it is affecting their vision. Things to consider are preferential seating, considerations as far as like light and hat, sunglasses indoors, and then accessibility tools. And then it's also maybe time to consider ECC. And that can be introduction to auditory and speech recognition. One thing to keep in mind is that due to the likelihood of neuropathy and nerve damage and loss of feeling in the extremities that people with diabetes can have, Braille may not be effective for them. Also look at independent living skills, career education, assistive technology. And there's a quote here, but the high level what you want to point out is that even if a student doesn't have low vision yet, if we know they're going to, it may be time to consider getting them some of this additional materials so that they're ready for that. And then also want to think about their social and emotional learning. So looking at the Oregon TSEL framework, the one that I'm focusing on is fostering a sense of belonging. Now this can be done both with the student individually. It could also be brought up with the teacher so that they're doing it with the entire class so that everybody knows what it is to be part of a diverse community and so that everybody can be working toward making that a reality. All right, and next, Kaprina is going to be talking about working with an adult client.
All right. Now we're moving to meeting the adult client. Next slide. Client benefits of O&M skill development. living a full life after diagnosis, some of the things that can help the individual who has diabetic retinopathy and to keep themselves safe and from injury, orientation, and mobility. Those skills will be a preventative measure and promote efficiency as far as independent travel. Some of the things that we do is we'll do a comprehensive intake on the client, a functional vision assessment, O&M assessment. We will address immediate vision needs based on the client's interest because we want them to be excited about what their goals are and also practical travel needs based on the client's interest. Next slide. All right. Questions, class. This could be for part of the discussion, so listen closely. Why are they particularly beneficial tools for someone with diabetic retinopathy? So you see the iPhone, you see the white foldable cane, and you see the dog guy. Next slide.
So let's talk to Ms. Davis. She's a mechanic with 30 years experience. She has diabetes and she was recently diagnosed with stage 2 diabetic retinopathy and she has blurred vision. Hi, Ms. Caprina. Do you have a minute?
I do. How are you, Miss Davis?
Well, I saw my doctor yesterday and I don't understand all that mumbo jumbo. Tell me what's going on with my eyes.
Well, Miss Davis, how many times have you seen cars come into your shop with their engines smoking because the driver ignored the oil indicator light, letting them know, hey, it's time to change your oil?
Too many times. Why won't they just change their oil?
And what usually happens over time when they keep ignoring that light?
The engine blows. Why won't they just change the oil? I don't understand. Just pay the $19.99 for an oil change. $19.99.
Exactly. Miss Davis, I got to tell you, your light is on. Let me show you. This here is a model of your eye. This part here is what we call the retina. Inside the retina are blood vessels. The retina is an eye tissue that promotes light perception so you can see. And as they become damaged, they leak fluid inside of your eyes. That is why your vision starts to get blurry. As time passes and you don't take care of your health, those blood vessels, well, they're going to get weaker and can grow abnormally inside the retina, causing blood vessels to leak even more fluid. Severe and proliferative, well, severe is stage 3, proliferative is stage 4. These are the more severe stages, and eventually that engine is going to blow, Miss Davis, and you could be completely blind. We don't want to go there.
I don't want to go there. I ain't giving up my vision that easy. Tell me what I need to do.
Well, you got to get that oil changed, eat a healthy diet, and get exercise, and make sure you're seeing your eye doctor, Miss Davis, on a regular basis.
Yes, I need my vision. All right, so that was an example for an adult. We do have a suggestion here to make it more kid-friendly. All right, Ms. Caprina, if you want to give us a couple resources for adults.
Yeah, just a few more tips here. We've got resources for newly diagnosed visually impaired individuals. We've got this Washington State's Department of Services for the Blind, and they have a great center-based service delivery model, very comprehensive. And if you call them, if you don't live in the Seattle area, because it's based on Seattle, Washington, I am sure that they will offer you and provide you a plethora of information and resources. And there's also the Lighthouse for the Blind that is also located in Central Seattle, and they provide employment opportunities for those individuals who have low vision, who are blind, deafblind, and they're also another great option as far as employment.
And if you don't live in the Seattle or Pacific Northwest, you can do a Google search, ask your doctor, or we have some more information in the appendices. And so Erin's going to go over our broad issue.
Yeah, so one of the highest risk factors for advancing diabetic retinopathy is poor management of blood sugar. And looking at that, research shows that one of the highest correlative factors to progressing DR is socioeconomic status. And Kaprina is going to talk about that a little bit more, specifically its overlap with people living in rural areas.
Exactly. There's a lot of information on these slides, but I want to hit a high-level overview, and you can read more about it later. People in rural communities generally have less access to affordable food. Next slide. Rural communities have a high ratio of fast food and convenience stores, meaning there is a lot of processed foods available. Next slide. Difficulty accessing healthcare means that diagnosis and treatments are often significantly delayed. Next slide. Rural communities have a much higher instance of poverty. Next slide. Overall, poverty, access to quality food, and access to healthcare mean people in rural areas are likely to have complications from diabetes, including progression of DR.
So the takeaway from all that, get your yearly eye exams, comprehensive, that include dilation, maintain a healthy diet and exercise routine. So we have a table of contents for you in our appendices, and this is all information that you can find on the slideshow that we'll share with you. Hopefully this was helpful for you.